You know, there's a microbe living inside most of us right now, in our airways. And most of the time, it's totally harmless. But it has this dark secret. For a few unlucky people, this super common everyday bacteria can turn into a real villain. So today, we're going to unpack the story of Haemophilus influenza.
It's kind of weird when you think about it, right? I mean, how can something be a totally normal part of our body's ecosystem, just hanging out in our nose and throat, but then boom, under just the right, or I guess wrong, circumstances, it flips a switch and becomes this life-threatening invader?
All right, so what exactly is this thing? Well, it's a type of bacteria. Scientists call it gram-negative, but that's really just a lab term for how they identify it. The important thing to know is that most versions, or strains of it, are no big deal. But a few of them are real troublemakers. And the worst part? They spread so easily. You know, through coughs, sneezes, the stuff of everyday life. Okay, so let's put our detective hats on and zoom in on the main suspect here. The family name is Haemophilus influenzae, sure. But there's one particular member of that family that has a really nasty reputation. It's the one we're most worried about.
And here it is, the big one, Haemophilus influenzae type B, or much easier to say, Haib. Now, other strains can definitely cause problems, but Haib is the one that's notorious for causing these really severe invasive infections, especially in little kids.
So here's what's so wild about this bacteria. The sheer range of trouble it can cause is just huge. We're talking everything from a minor annoyance all the way to a full-blown medical emergency. You can think of it like this bacteria has two completely different faces. On one hand, it's behind some really common stuff, like middle ear infections or sinus problems. Annoying for sure, but manageable. But then there's the other side, and it is terrifying. It can trigger absolute catastrophes. I'm talking about meningitis, which is an infection of the brain and spinal cord, or epiglottitis, where the throat swells up and can actually block your airway, and even bacterium, which is a super dangerous infection that gets into your bloodstream.
Okay, so a good question to ask is, if this bacteria is literally everywhere, why aren't we all getting sick all the time? Well, it turns out that some people are just way more vulnerable to its dangerous side. Let's break down who's most at risk.
First off, age is a huge deal. Little kids are the most vulnerable, mainly because their immune systems are still figuring things out. Then there's the environment. Crowded places, think daycare centers, naturally increase the chances of exposure. And of course, your underlying health is absolutely critical. If someone has a condition like sickle cell disease, or they don't have a spleen, or their immune system is weakened, their risk for a really bad infection just skyrockets.
So what happens when this thing does go on the attack? How do doctors fight back? Let's walk through how they actually diagnose and treat these infections.
It's pretty much classic medical detective work. Step 1, the doctors have to get a sample. That could be blood, pus, or if they're worried about meningitis, spinal fluid. Then that sample goes to the lab, where they try to grow or culture whatever's in there to see if Haemophilus influenza pops up. And if it does, they hit it with a bunch of different antibiotics to find its kryptonite. You know, the one drug that will knock it out for good.
And yeah, the treatment is definitely not one size fits all. For something like a simple sinus infection, a course of oral antibiotics might do the trick. But for those really life-threatening situations, the response has to be way more aggressive. For meningitis, we're talking powerful IV antibiotics, plus corticosteroids to try and prevent brain damage. And epiglottitis, that's a code red emergency. It needs immediate breathing support. Sometimes they even have to insert an artificial airway, right along with those IV antibiotics.
Okay, so we've seen how bad the villain can be, but now we get to the part of the story where everything, and I mean everything, changed. It's time to meet the hero of this story, the thing that completely turned the tables on this bacteria. And I'm not exaggerating when I say this. The Hib vaccine is genuinely one of the great success stories of modern medicine. Why? Because it didn't just treat the disease, it stopped it cold in its tracks. It has prevented countless cases of childhood disability and even death.
Yeah, this quote from the MSD manual really nails it. The impact wasn't just a little dip, it was absolutely massive. The vaccine goes right after that most dangerous strain, Haib, and because of it, those terrifying emergency room visits for things like meningitis and epiglottitis in kids have just plummeted.
The whole prevention strategy is really smart. It has multiple layers. The Hib vaccine itself is the main shield, right? It's a standard part of childhood vaccinations now. But there are backup plans. So if a serious case does pop up in a household,
People who are in close contact might get an antibiotic just to stop it from spreading, and any kids around who haven't been vaccinated get the shot right away.
So if there's one thing to take away from all this, it's this. A bacterial infection that was once genuinely feared, a common cause of death and disability in children, has been almost completely controlled. And not by some miracle cure, but by a brilliant, proactive act of prevention. This whole story, it's not just about a bacteria. It's about the unbelievable power of vaccines to literally change the world.
You know, the victory over Hib is such a powerful reminder of what we can achieve when science and public health work together. It really makes you wonder, doesn't it? What's the next big one? What other diseases that we fear today will be conquered next? And what amazing breakthrough is waiting for us just over the horizon?